All right, so we're diving into neurological assessment today,
Okay.
and we've got a couple of sources to work with.
That's good.
One's kind of an overview of the whole nervous system,
Right.
and then the other one really gets into like the how-to, like how to actually assess somebody's neurological status.
Yeah, the hands-on part.
Exactly. So I'm excited. Like, let's put on our detective hats.
I love that.
Figure out how to read those clues.
Yeah, it's amazing how much you can figure out just by looking at someone.
Right, like what's going on in their brain based on what you're seeing.
Exactly.
Okay, so before we get all hands-on with the assessment part,
Sure.
let's back up for a sec, talk about the basics.
Okay.
Our first source talks about the central and peripheral nervous systems.
Mm-hmm.
Can you give us a quick rundown of those?
Yeah, so the central nervous system, or CNS as it's called,
Okay,
that's your brain and spinal cord. Think of it like the command center.
okay.
And then you've got the peripheral nervous system, the PNS. That's everything else. All those nerves that branch out from the spinal cord,
Right.
reaching every single part of your body. So it's like the communication line
Oh, that's a good way to think about it.
between the central nervous system and everything else.
So, like, the brain's the CEO making the decisions.
Yes.
The spinal cord's the main communication line.
Yes.
And then the peripheral nerves are like all the messengers running back and forth.
Exactly. And those messages are being carried by neurons.
Okay.
Think of those like electrical wires carrying signals all over the place.
Gotcha.
And then you've got glial cells surrounding those neurons.
Okay.
Those provide support and protection.
Like insulation around a wire.
Yeah, perfect analogy.
Okay, that makes it so much clearer.
Good.
I guess we don't have to know every single neuron and glial cell.
Right. Not for our purposes today.
But just knowing that this whole communication system is there
Yeah,
helps us make sense of why we might see certain things in a patient.
exactly.
Like if a nerve's damaged, that signal's messed up.
Yeah.
And then maybe they have weakness or numbness.
Exactly. Or any other number of issues.
So that's where the neurological assessment comes in.
Yes.
Yeah.
It's how we figure out what's going on with that communication system.
Okay, perfect. Let's move on to that assessment piece then.
Right.
Our second source really dives into all the different parts of that focused neurological assessment. Level of consciousness, orientation, muscle strength, pupils, cranial nerves.
Yep. All the important stuff.
Where should we even start?
Well, I'd say level of consciousness is always the first priority.
Okay, makes sense.
Mm-hmm.
But our source mentions all these different terms for levels of consciousness.
Right.
Like alert, lethargic, obtunded.
It can get confusing.
Yeah.
Yeah.
How do you actually tell the difference in real life?
You know, it is subtle, but think about patients you've seen. Alert is, well, alert. They're awake and responsive, oriented.
Gotcha.
Lethargic, they're drowsy, but you can wake them up pretty easily.
Right.
But obtunded, they're much harder to rouse, might only respond if you keep stimulating them.
Okay, so it's a spectrum
Exactly.
from wide awake to like barely there.
Exactly.
And it's all about how they respond.
To you, to stimuli.
Okay, that makes sense.
Right.
What about orientation then? What does that even mean?
So orientation is all about whether the patient knows who they are,
Yeah.
where they are, and what time it is. Person, place, time.
So if they're disoriented, could be a problem.
It could be something simple like medication side effects.
Right.
Or it could be something more serious like delirium or dementia.
Okay, so we've got level of consciousness, orientation.
Mm-hmm.
What about pupils? Remember pure LA from nursing school?
Of course, pupils equal, round, reactive to light and accommodation.
It's a mouthful.
It is, but it's important. We're looking at the size, the shape.
Okay.
Do they constrict when you shine a light in them? Do they converge when they look at something close up?
So if anything's off with those pupils, could be a sign of trouble.
Exactly. Could be a problem with the nerves that control the eyes.
Oh.
Or even something going on in the brain itself.
Okay, now speaking of those nerves.
Cranial nerves.
Yes. I remember learning all 12,
Oh.
but keeping them straight was a challenge.
I think we've all been there.
I had this mnemonic on old Olympus's towering top. A Finn and German viewed some hops.
Ah, I like that one.
It's silly, but it works.
It definitely does. And those cranial nerves, they control so much.
Right.
Eye movements, facial sensation, hearing, taste, swallowing.
Wow.
So checking those nerves gives us a window into how the brainstem's doing.
Okay, so we've got a good handle on the basics of the assessment.
Yeah, I think so.
But how do we take those findings and actually connect them to what might be wrong?
That's the fun part. It's like detective work, looking for clues.
I like that.
We're going to put those puzzle pieces together and figure out what the picture is.
Okay, I'm ready for a challenge.
Ready.
All right, so we've covered those basics, like the different parts of the nervous system and how to do that focused neurological assessment.
Yeah, we've laid the groundwork.
But what do we do with all that information? Like,
Huh.
how do we actually connect what we're seeing to, what might be going on with the patient?
That's where the critical thinking comes in. You got
Right.
to look at the whole picture, the patient's medical history, what medications they're on, and then, of course, those neurological findings from the assessment.
Okay, so let's say you're working with a patient and they come in with slurred speech
Hmm.
and their face is drooping.
Okay, yeah.
What are you thinking? Like, what goes through your head when you see that?
Honestly, my first thought would be stroke. Those are pretty classic stroke symptoms.
Right, right.
But of course, you can't jump to conclusions, got to gather more info.
So what kind of information would you be looking for?
Well, first things first, I check their level of consciousness.
Okay.
Are they alert? Are they responding to me? Do they know who they are, where they are, what day it is, that sort of thing?
So that orientation piece we talked about.
Exactly. And then I do a more in-depth neurological exam, really focus on those cranial nerves, like check their pupils, see how their eyes are moving, see if they can swallow okay.
But all those findings would help you narrow it down.
Yeah, definitely. If they have weakness or numbness, but only on one side of their body,
Oh.
that would make me think stroke even more. Or if their pupils are unequal or fixed, that could mean there's pressure building up in the brain.
So it's all about those little clues.
Exactly, like putting a puzzle together.
I like that analogy.
And remember, with something like a stroke, time is brain.
Oh, yeah, I've heard that.
The faster we can recognize those signs and get the patient treated, the better their chances of a good recovery.
So we really have a huge responsibility as nurses.
We do. We're often the first ones to see those signs.
Right.
So we got to be comfortable with those assessments, and we got to trust our gut. If something feels off, we got to speak up.
Right. Advocate for our patient.
Exactly. Our source talks about documentation and communication, too. Those are key.
Oh, yeah, for sure. Like, it's not just about doing the assessment, right? You have to write it all down so everyone else knows what's going on.
Absolutely. And it's got to be clear and concise, got to use the right medical terms. And if we're worried about something, we need to let the doctor know right away.
Okay, so we've talked about those stroke symptoms. Those are definitely red flags.
Right.
But what about other neurological conditions? What are some of the other things we might see?
Well, besides strokes, we might see patients having seizures or with head injuries, brain tumors, infections like meningitis, or even chronic conditions like Parkinson's disease or multiple sclerosis.
Wow, that's a lot.
It is, and the assessment and what we do will vary a bit depending on what's going on.
Right, of course.
But there are some common things we always check. No matter what, we got to assess their level of consciousness, orientation, and their vital signs.
Okay, makes sense. And those help us figure out what to do next.
Exactly. Like if someone's having a seizure,
Yeah.
our top priority is to keep them safe, make sure they don't hurt themselves.
Right.
So we might need to turn them on their side, loosen any tight clothing, and make sure the area around them is clear.
Gotcha. Got to keep them safe.
And then we'd want to carefully document everything about the seizure, how long it lasted, what kind of movements they were making, any other symptoms.
And let the doctor know what happened, right?
Immediately.
This is all making a lot more sense now.
Good. It's like every neurological condition has its own quirks,
Right.
but the basic principles of assessment and intervention, those stay the same.
So we're always using those tools we talked about.
We are. And remember, you don't have to know everything.
Oh, it's good to hear.
If you're ever unsure, you can always talk to another nurse, look things up,
Teamwork makes the dream work, right?
Exactly. And speaking of teamwork, we can't forget about the patient's family.
Oh, right.
They can tell us so much about the patient's history, their normal behavior,
Right.
and they often need support and education, too. They're going through this, too.
That's such a good point. It's easy to get caught up in all the medical stuff and forget that there's a whole person there with a family, with a life.
Exactly. It's not just about the disease, it's about the person.
I love that.
Oh,
Okay, so we've talked about those red flags,
right.
connecting the dots, taking action. What about treatment? What's our role there?
Nurses are involved in everything, from giving meds and watching for side effects to teaching patients and families about their condition and how to manage it.
So it's really a team effort.
It is. Can you give me some more specific examples?
Sure.
So let's say someone comes in and we think they might be having a stroke. Once we know for sure it's a stroke, they might need medication to break up the clot, or maybe even surgery to remove it.
Okay.
We'd be monitoring their vital signs, checking their neurological status constantly, making sure they get their meds.
And pain management would be important too, right?
Absolutely. We want them to be comfortable, but we also have to be careful because some pain meds can affect their neurological status,
Yeah. Right. It's like walking a tightrope.
It is. We're always balancing all these different factors, managing symptoms, trying to prevent complications, but always keeping the patient's overall well-being at the forefront.
It's a lot to juggle.
It is, but it's so rewarding.
And it's not just about those immediate interventions.
Yeah, it's about the long haul, too. Rehab, making sure they can function as well as possible.
So like with a stroke, they might need physical therapy, occupational therapy, speech therapy.
Exactly. It takes a village. And we as nurses, we're kind of the coordinators.
Right. Making sure everything runs smoothly.
We work with the doctors, the therapists, social workers, the patient, their family. Everyone's got to be on the same page.
It's amazing how everyone comes together.
It is. And it's important to remember, neurological nursing, it's not just about knowing all the technical stuff.
Oh, okay.
It's about compassion, empathy, really connecting with your patients.
So we're treating the whole person, not just the disease.
Exactly. We got to see the person behind the diagnosis, understand how this is affecting their life, their family, everything.
That brings us back to that communication network idea.
Right.
If that network's messed up, it affects everything.
It does. And we as nurses, we help them through that, help them adapt, help them find a new normal.
I can see how that would be challenging, but also so rewarding.
It is. This has been such a great conversation.
I know. I feel like I'm understanding all this so much better now.
I'm glad to hear that. And this is just the tip of the iceberg. There's so much more to learn about neurology.
Well, on that note, I think it's time for a quick break.
Okay.
We'll come back and wrap things up with some final thoughts. So we talked about recognizing those red flags and connecting the dots, figuring out what might be going on with the patient.
Right. And taking those first steps, making sure the patient's safe.
Exactly. But then what? What are some of the actual treatments we do for neurological problems?
Well, that really depends on what the problem is, Every condition is different.
Of course, of course.
But no matter what, nurses are involved in all of it. Giving medications, watching for side effects, teaching patients and families how to manage things.
Okay, so it's a really hands-on role.
It is. Can you give us some examples of what that looks like in real life?
Yeah, for sure. Like, let's go back to that stroke example.
Okay.
Once we know it's definitely a stroke, what happens then?
Well, they might need medication to try and break up that clot, or sometimes they even need surgery to remove it.
Wow.
And we'd be right there monitoring their vital signs, checking their neurostatus constantly, making sure they get those meds.
And what about pain? I imagine that's a big issue, especially after a stroke or surgery.
It definitely is. We want to make sure they're comfortable, but we also got to be careful because some pain meds can actually mess with their neurological status.
Oh, right. Got to think about those interactions.
Yeah, it's a delicate balance.
Like managing symptoms, preventing complications, but always thinking about the patient's overall well-being.
Exactly. And it's not just about those immediate interventions either.
What do you mean?
Well, we also have to think long-term about rehab, helping them get back as much function as possible.
Oh, right, right.
So like after a stroke, they might need physical therapy, occupational therapy, maybe even speech therapy, depending on how they're affected.
It sounds like a huge team effort.
It is. Doctors, therapists, social workers, nurses, of course, and the patient and their family. Everyone's got to work together.
And we as nurses, we're kind of the glue that holds it all together.
We are, in a way. We make sure everyone's on the same page, make sure the patient's getting everything they need.
Wow. It's really amazing to see how all these different people come together.
It is. And, it's important to remember neurological nursing, it's not just about the technical stuff.
Oh, okay.
It's also about compassion, empathy, really connecting with your patients on a human level.
So yeah, we're treating the whole person, not just the disease.
Exactly. We have to remember there's a person behind that diagnosis, understand how this is affecting their life, their family, their whole world.
That brings us back to that idea of the nervous system being like a communication network, right?
Yeah.
When that network's messed up, it impacts everything.
It does. And we as nurses, we can help them navigate those challenges, help them adapt, help them find a new way forward.
So I can see how that would be incredibly challenging,
It is.
but also so rewarding.
Oh, absolutely. It's a privilege to be part of that journey with them.
This has been such an eye-opening conversation.
I'm glad you think so.
I feel like I have a much better grasp of, what neurological assessment really entails and what our role is as nurses.
Well, I hope so. And remember, this is just the beginning. There's so much more to learn about neurology.
Right. Always more to explore.
Always. But I think we've laid a good foundation here.
Yeah, I think so too. Well, this has been fascinating. really.
I've enjoyed it.
I'm so glad we had the chance to dive into this today.
Me too.
Thanks for joining us on this journey into the world of neurological assessment.